I'm just going to introduce our panel. You just heard from Matt, so I'm going to keep it brief. So we have Matt Morrison with Working America. To his left, we have Geoff Garin, who's with the pollster, polling firm Hart Research, and then Leslie Frane with SEIU. So I'm just going to kick it off right away. Matt, you touched on this, so I guess we're looking at polling, seeing what messages energize voters going into 2020. The 2018 midterms, obviously, we saw that healthcare was the biggest issue that drove people's votes, and it benefited Democrats politically. How confident are you all that 2020 can be the same, both as far as what issues are driving votes and who it benefits politically?
Well, I'll start off. I'm betting $1 to a donut that we aren't the only ones who have the data that I just looked at. I'm pretty certain that I think the president has one of the smartest campaign operations I've observed from afar, putting aside kind of his administration's conduct. And so he has an incentive to keep the conversation on the thing that causes fear. I think any intelligent observer is going to understand that Democrats have a strong incentive to elevate the salience of this message and make sure that the framework is fought on their terms.
Well, we've been tracking for Protect Our Care over time before the 2018 congressional elections, and then since then, what are the most important issues to voters? And in our most recent poll, we asked separately about the presidential election and their congressional elections. And there's been no diminution at all in the level of emphasis on health care among voters. It was in 2018, as you said, the #1 issue. It will be in 2020, both as a presidential voting issue and as a congressional voting issue. I think the framing of the issue will change from the conversation in 2018 that was so successful for Democrats, that in 2018, it was really about stopping Trump and the Republicans from taking health care away from people and their efforts to undermine the Affordable Care Act and people's access to affordable health care. I think for 2020, that part of the conversation will still be very important, but there is a greater expectation that this is not an election just about stopping things from happening, but also making things happen. And so it will become more incumbent on Democrats to talk about what they're for, both as a presidential leadership issue and if we have majorities in the Senate as well as the House, what are we going to do with those to make sure that all Americans have access to affordable quality health care?
So I agree with what both Matt and Geoff said. I think that the salience of the issue is undeniable, and I think the challenge for Democratic candidates and for advocates who are lifting up this issue is to really balance three things. One is the point that Matt made earlier about the importance of comparing and contrasting and making sure that we don't get mired completely in the debate over is it Medicare for all or is it Affordable Care Act improved, but keep the focus on the fact that the Trump administration and his allies have consistently tried to strip away health care from tens of millions of people in this country, to focus on the litigation that would repeal the Affordable Care Act, to focus on the sabotage that the Trump administration has led, to make sure that we keep that attack in the foreground, but also, and this goes to Geoff's point, to be for something. And I think we need to be for a broad vision of universal access to affordable quality coverage, but that we also, because I think most people appreciate the fact that much as I would love to see a shift of power in the Senate, that's not something we can take for granted. I think that focusing on what are the concrete steps that we are going to take that address the issues that voters care most about, starting with affordability, is also important. So I think it's the combination of compare and contrast and name the opposition and hold them accountable, project a broad vision for what the future of healthcare should be, and then identify what are the concrete next steps that voters can say, actually, that will change my life, that will mitigate or alleviate the anxiety that Matt talked about in his presentation.
So Leslie, based on your comments, I take it maybe it's not wrong to assume that the latest presidential debates among Democrats you might find a little exhausting or frustrating, right? Because they are not talking about the things that you just largely mentioned, right? But I guess there's still time for change. So, so can you guys talk about how healthcare comes up in conversations in the field itself? Like, how do people, what are they talking about? You know, and how are they bringing it up? Is it about them, their family members? Could you just get into that a little bit?
Well, for many Americans, they're really talking about this in very personal terms. That about half of all Americans are stressed over healthcare costs, and those get expressed in a variety of different ways. Some people express it in terms of what they're paying in their healthcare premiums. Much more frequently, people express concerns about their out-of-pocket costs for co-pays and deductibles. There's a lot of instances when we encounter engaged voters who say that their out-of-pocket costs, specifically with regard to prescription drugs, is a problem for them. So this is personal for a lot of people. There is something that we've been finding over time that hasn't changed all that much. Is we ask two different questions. Is how well do you think the healthcare system is working for you and your family? And right now, around 63% say that it's working very well or pretty well for them. The balance say not so well or not well at all. So that's 37% is a lot of people. And then when we ask them how well is it working for most Americans, the numbers are about the opposite of that. About 33% say it's working well for most Americans, and 2/3 say that it's not working well. If you think both of those things probably can't be true at the same time, right, arithmetically, but if you think about the intersection of those two results, it really kind of, from a political perspective, can organize your way about thinking about all of this, because there's a group of voters who think it's working, not working well for them and not working very well for anybody else. They tend to support a lot of very aggressive solutions to that. There's a group of people who think it's working pretty well for them and for other people. They are really not in our communication audience very much. And then you have this middle group of people who say it's working okay for me, but not working well for other people. They really would like to fix the system so that it works well for everybody, but it is important to recognize that at some level they feel like they have skin in the game. While they have something to gain, they also have something to lose. And so that really creates kind of the strategic landscape. There's not very many people left in that other quadrant of who say, well, it's working badly for me, but working well for everybody else. That's a pretty small group of voters.
So I'd love to answer that question from the perspective of members of my union, the Service Employees International Union. SEIU unites millions of workers of different races from different places in a struggle for justice, both at work and in our communities. And there is really no issue that our members feel more passionately about than healthcare. I think that's especially true of the over 1 million healthcare workers that we represent, who work in nursing homes, in hospitals, in people's homes, in clinics. Our members are committed to a vision of universal health care and are really proud to have played a role in, more recently, in protecting and defending the Affordable Care Act from the attacks over the last few years. Our members approach the healthcare issue really from three different perspectives: from the perspective of consumers, from the perspective of employees, and from the perspective of caregivers. And as consumers, they experience the same challenges that low-wage workers everywhere do, challenges that I think both Matt and Geoff have done a great job of outlining. The challenge of spiking premium costs, of rising out-of-pocket costs, particularly for prescription drugs, and for many of our members who can't afford or earn too much to get Medicaid, but can't afford employer-sponsored coverage, the incredible challenges of living without coverage at all, and the hard choices that you have to make around, do you bring your kid to the doctor or hope that she feels better the next day, knowing that the next healthcare crisis could result in bankruptcy. As employees, healthcare employees, we also experience a different set of challenges because the healthcare system is broken for the workers who do the work every day. Broken because the jobs are so often underpaid. Home care workers earn a median wage of $11.47 an hour. Nursing home workers earn a median wage of $13.87 an hour. The majority of them have totally inadequate benefits, and many have irregular hours as well. It's somewhat better when workers have a union, but unionization alone and collective bargaining alone can't change the bad incentives that are built into the system, the inadequate reimbursement levels in many cases, and frankly, the fact that decisions about how to spend the reimbursement that is there are too often driven by the profit motive, even in the nominally nonprofit part of the industry. But the third challenge they face is as caregivers who experience the pain of their patients day in and day out, emergency room nurses who deal with health crises, patients with health crises that never needed to happen, except the patient didn't have access to good primary care. The nursing home worker who works short-staffed because of inadequate reimbursements or decisions that her employer has made, who has to choose between which of the 4 call bells to answer, knowing full well that every one of those nursing home residents needs immediate attention. Or the home care worker who more often than not stays hours after their paid hours have ended because it's just not safe to leave the resident alone, but that's all the resident can afford, or that's all Medicaid will pay for. So we experience it on those 3 levels, and the anxiety that we feel is the anxiety that Matt talked about. But I wanted to lift up 3 issues that I think are particularly important to our members. The first really is long-term care, an issue that was largely left out of the Affordable Care Act for very good reasons of politics at the time. But as the demographics of this country change, the demand for long-term care services obviously is only increasing. The workforce crisis is only growing, and we need to make sure that the next generation of healthcare reform includes access to long-term care services for people who earn too much for Medicaid, but because they're not independently wealthy, can't pay for home care or nursing home care themselves. The second issue that I would lift up for our members is healthcare equity. The majority of our members are women, the majority are people of color, and in many places the majority are immigrants. But all of our members, black, white, and brown, see the inequities of the system, and they understand viscerally, if not statistically, why mortality rates are so much higher in zip codes where the majority of the population are people of color. They understand the same things about infant mortality rates, and they are committed to making sure that the next generation of healthcare reform deals with not just affordability, but also healthcare equity, so that every person in this country, black, white, or brown, regardless of where they come from or their income level, has access to not just quality healthcare, but equitable healthcare. And then the third issue that I would lift up that I think is of particular importance to our members really has to do with the right to have a union. Every poll shows that the majority of workers in this country would like to be in a union, but the current system is so broken that working people have very limited path to get a union, both because 40% of workers in this country are excluded from labor law. Think about home care workers in red states. Think about public employees in red states. Think about people who work for franchises. Think about people who work in the gray market. Or even if you technically have the right to organize a union, because of the way that the rules have been rigged, and this has gotten worse under the Trump administration, but was true before as well. Employers who don't want a union are able to legally and illegally retaliate against workers who stand up to have a union with very little accountability for the employers. So I would say those three issues are particularly salient for our members: the question of long-term care, the question of health equity, the question of how do all workers have a path to have a union. And on that last issue, I would just close by saying unionization for healthcare workers is important for two reasons. For the obvious reasons is it's how we're going to raise standards and create family-sustaining jobs out of poverty-level jobs. It's how we're going to make sure that healthcare workers who give good healthcare can also get good healthcare for themselves and their families. But it is also because healthcare workers are such strong and effective advocates for healthcare justice, for healthcare reform, but they can't lift up their voices unless they can combine their voices, and they can only combine their voices if there's a path to unionization. So I would just lift up those three issues as things that may not surface in the polls for the general public, but we feel strongly need to be included in the next generation of healthcare reform. And we think that if we take on the challenge of talking about those issues, actually can be strong election issues as well.
Sure.
Anything to add, Matt?
So let me start with the zip code observation that Leslie just made. If you are anxious about your ability to afford care, your ability to access care, the choices you're making, chances are that is not the only thing you're anxious about in life. And so the type of zip code discrimination and intensity that people feel is something that pervades all dimensions of their life. So to the extent you're talking to that same group of voters about the right to form a union in a meaningful way, you see a lot of concurrence of support between those issues, or we do, I should say. Secondly, I think the language that I hear from voters tends to be really explicit. It is, I am paying $1,000 a month in premiums. The cost of my insulin is X amount. It is a very specific and familiar way that people relate to the healthcare system. So it's not academic. It's not kind of top line. People can really speak to this from personal knowledge. I think the last piece that I want to observe is that the support for expansive universal care and access, where we don't even have to think about these questions, we're thinking about how we can be physically well, is the strongest sentiment that we hear consistently, and it does not matter your race, your place. That is it. Everyone agrees with that sentiment. To the extent people are unhappy with the system, they're not unhappy with their providers. They like their doctor, they like their home care worker, they like the individuals they're working with, but they are not attached to this system writ large. I mean, their insurance coverage is their security blanket, sure. But our entire healthcare system, such as it is, I wouldn't say they're ready to burn it down, but they wouldn't be upset if someone else did, as long as it didn't cost them the access and quality they need.
So we're sitting in a room of people probably very eager to make healthcare a big issue in the 2020 election. So I want you all to talk about, Matt, you touched on this a bit earlier. Can you talk about focus groups or polling that you've done on healthcare messages and what is showing to be effective in energizing people to go use this as a voting issue, and what isn't effective?
Sure. A great example, we were active in the Kentucky gubernatorial race last year, and we were able to use feedback from the doors. One woman said to us in this kind of really poignant way that I'm one emergency room visit away from losing everything. We took that language and we turned it into content that we could then test, digital ad content, I should say, that we could then test randomization so we could see what was affecting vote choice. And what we found was that there was a subgroup of voters that were particularly important. Registered Republicans who are modeled to be persuadable voters. We were able to take that learning and scale it to all of the little red part. Kentucky as a state is not entirely red. There are lots of red parts of it. But we were able to scale that message to 200,000 voters across the state, largely in rural Kentucky. And what you see is that when people get a message that feels personally resonant like that, and they get it at scale, especially close in time to the election, around 4%, which doesn't sound like a lot, but when you're talking about close elections, 4% of this type of voter said, wait, that's me. I recognize myself in this. You know, Geoff talked about folks who aren't often in our communications streams. What we're finding is that there are a group of people who often are not in our communication streams for other reasons, but they've never heard our message, who tend to be very receptive. That example I just told you about delivered an extra 7,900 votes in a race that was won by 5,150 votes. Now, in a race that close, everyone was the difference maker, like, undoubtedly. Working America was not the only contributor here. But it tells you that what we're talking about has deep resonance far and wide. And there might be an election in Kentucky this year that people would like to think about.
Well, I think Matt's example is super important because it, I think, elucidates ways in which you ought to think about polling results. My partner, Fred Yang, was Governor Beshear's pollster, and we worked for Governor Northam in Virginia, and both states where Medicaid expansion was a front and center, very much of a front and center issue. If you look at a poll and said, what are the healthcare issues that concern you today, the cost of healthcare and healthcare affordability comes in substantially ahead of healthcare coverage for most voters, not for every group of voters, but for most voters. But you know, that notwithstanding, in both Virginia and Kentucky, when voters were presented with this binary choice about should you or should you not expand Medicaid so that more people in your state can have access to affordable health care coverage, that was a really meaningful issue for a lot of voters. They think that there is a benefit, there's a public benefit that goes beyond the individual when more people have access to affordable coverage. They also think it is that, you know, just as a matter of values, it is the right and decent thing to do. And so lifting up those kinds of issues of coverage is important. And, you know, there is, I think, as I said, people want to know what Democrats are for, and making sure that that we treat healthcare as a right, that and that also that all Americans have access to healthcare is really important. But this issue of Republicans wanting to take healthcare away from people also is really very powerful. And the fact is they do want to take healthcare away from people, that their proposals do that repetitively. You know, the Trump administration is about to, you know, take a next step in recommending block granting of Medicaid. Well, if you just sort of talk about block granting of Medicaid, that's a pretty opaque issue for the average voters. But if you think about what that means for people's access to nursing home care, or if you have an elderly person or a child with a severe disability who needs that kind of care either in a facility or at home, that's powerful to voters. And if it means that lots and lots of your fellow citizens or residents of your state are going to lose their health care, that's very meaningful for people. The one other thing I kind of want to mention that is really a kind of a bridge between affordability and coverage is something that Matt mentioned in his earlier presentation, which is the role of the insurance companies and the drug companies. We, in our last Protect Our Care poll, we asked people, who do you blame for the problem of high healthcare costs? And you know, I live in Washington. We're kind of used to people talking about political actors, and maybe they would blame Trump for high healthcare costs because of his efforts to sabotage the Affordable Care Act. Maybe Republicans would blame Democrats for passing the Obamacare in the first place, and whatever. That's not at all what normal people talk about. When you ask them who do they blame for the problem of high healthcare costs, It is the drug companies and the health insurance companies.
Was there an all
That's-
of the above, like,
What?
was there an all of the above answer that people
Well,
could give, or was it just one or
No,
the other?
well, you mean between the political actors and the
Between industries, I guess I'm asking.
No, no, it's really the instinct is that this is not about the political actors. This is first and foremost about a healthcare system where more drug companies than insurance companies, but where they charge too much because they can. And that's what they think of as a broken system. And the case for universal coverage becomes much more powerful if it's connected to breaking the power of drug companies and insurance companies. So that it's not, this is not just an argument about how do we cover all Americans, but how do we have a healthcare system where drug companies and health insurance companies are not ruling the roost and setting the terms of how people get their health care and how much it costs them to get their health care. And there is a view that the companies not only rule the roost in the marketplace, but in the halls of Congress as well. And it's very, that for members of Congress who are kind of recognized for being part of that, when it's front and center for them, voters, I think, punish them. It's not kind of the most direct example, but one of the most, you asked about messages, one of the most powerful things you tell people is that a Republican voted for a tax cut bill that provide billions and billions of dollars of tax cuts for drug companies. And while they continue to raise their prices, that really annoys the hell out of people. And when people have a demonstrable record of standing up to drug companies or health insurance companies, voters tend to kind of reward them for that and see them as being on their side.
I actually want to use that to segue into my next question, which is about prescription drug pricing. Not this year, it's 2020. Last year, so we saw Congress repeal a handful of taxes that were included in the ACA on industry, the medical device tax, health insurance tax, and those were granted pretty big giveaways, right, to those industries. They also failed to do two things that were pretty high priority or very high priority on voters' lists, which is to address surprise medical bills and prescription drugs, like as in a bill didn't get to the president. Is that a liability for both parties if those don't get done this year?
Well, there is no more popular piece of legislation for the Congress today than H.R. 3. Nobody knows it as H.R. 3, but it is the legislation passed by the House, sitting in Mitch McConnell's Senate graveyard, that gives Medicare the power to negotiate with drug companies for lower prices. 90% of Americans, we did a project on this for a philanthropy called Arnold Ventures. 90% of Americans support giving Medicare the power to negotiate for lower drug prices. 90% of Democrats do, 90% of independents do, and 90% of Republicans do. And it's a durable support that if you make all of pharma's arguments about that this is going to take the money away from innovation or from research and development, people still believe that that Medicare should have the power and use the power to negotiate with drug companies for lower prices. And because the Democrats in the House of Representatives have passed that, and the Republicans in the Senate are blocking it from passing, I think it becomes a very ripe issue for debate in the 2020 election.
So do you think that changes at all, given that it's not H.R. 3, granted, which is Speaker Pelosi's legislation, but Senate Finance Committee Chairman Chuck Grassley, along with his Democrat counterpart Ron Wyden, also have a prescription drug bill that Senator Grassley is very adamantly pushing Senate Majority Leader Mitch McConnell to take up, and he's not listening. So I would just wonder if you think...
We've actually looked at this kind of the politics of, what if there's a Republican senator, a Senate candidate who says, well, I support that, but I don't support Medicare negotiation. And the Democrat is, for Medicare negotiation. That being for Grassley-Wyden does not mitigate at all the failure to support giving Medicare the power to negotiate.
I see. Leslie, you were going to go ahead.
So I don't have a lot to add to what Matt and Geoff said about the polling, that you are way closer to it, and I agree with everything that you said. But I wanted to circle back to the question that you asked before about what works and what doesn't work. Sure. More from the field perspective, where I would say we learned a lot in 2018. Whenever I meet with a group of our members, I say, what did we learn in 16? And the lessons are about a lot of things we shouldn't do, and what did we learn in 18, and we learned a lot. And so I would just, to share some of those lessons, I feel like what works is starting the conversations with voters early. And frankly, we are already knocking on hundreds of thousands of doors, particularly in battleground states, and starting not with candidates. In fact, our union has not done an endorsement, so we wouldn't even know what candidate to talk about if we wanted to, but to start rather with the issues and having the conversations about why voting matters. Because at the end of the day, I think we strongly believe that the path to victory for a Democratic presidential candidate in 2020 lies largely through expanding the electorate and motivating infrequent voters and first-time voters to vote. And sometimes people caricature this. It is not a harsh dichotomy between speaking to swing voters, the Obama-Trump voters, and first-time voters over here. Obviously, we have to do some of both. But at the end of the day, strategies that motivate infrequent voters and first-time voters are very different in terms of what works and what doesn't work. And it really means leading with issues. And it means identifying one-on-one voter contact as a key tool, but also not the only tool. And so the level of mobilization that we do to create, all of us together, to create events, to create earned media that lift up the issues that Matt and Geoff are talking about, how they resonate. Because it's not just a question of what are the issues, it's a question of how do we communicate those messages. And I feel like specificity matters. It's not the Affordable Care Act. It's how do you make sure that if you have a pre-existing condition, you have a health insurance. It's getting specific about the things that affect individual voters. The messengers matter, and I would argue that consumers are incredible messengers, but so are workers, given the credibility that registered nurses, that nursing home workers, that home care workers carry, that the messengers matter, but that the consistency of the conversations about the issues and starting not with the candidates and what they say, but with the voter and what they think matters. And I would specifically say what doesn't work, and I want to go back to the need to expand the electorate in communities of color here, is sort of, I would say, a traditional approach to get out the vote in particularly Black communities, where it's a formula of go to Black churches and then come in the last 3 weeks and encourage people to vote is just a failed strategy. And figuring out how do we engage voters early, and how do we have our ratio of listening to talking be higher, and how do we have our ratio of conversations about issues to candidates be higher. I think those are 3 things that are going to work, and it's going to take a combination of direct voter contact, it's going to take use of social media and technology, but it's also going to take a whole lot of mobilization of people in the streets, not necessarily at the campaign rally for candidate so-and-so, but at the event that lifts up why we need a candidate who supports universal health care and the issues that we care about. And then voters can make the connections if we lift up the issues.
Well, so actually, Leslie, I want to just to piggyback on that. So there is, and we've seen this even in the primary, which is that there is a divide right now over what do we do beyond the Affordable Care Act, whether it's Medicare for all, whether it's expanding on the ACA, even among labor unions, there isn't exactly uniformity in what various groups think should be the right approach. I mean, so does that affect your ability to kind of organize these voter coalitions to support a candidate that might eventually beat President Trump, or does it not really get to that level?
So I feel like this is, again, where we can learn from not just 2018, but 2017, where I think that the coalition that we built to fight back the attacks on the Affordable Care Act and Medicaid and was really one of the most vibrant coalitions that I've ever had the privilege of being part of. And I want to start by acknowledging the incredible work that Families USA did in helping to lead that coalition. But it wasn't just our organization and Families USA, it was myriad national organizations. I want to call out sort of two categories of groups that I think have been under-recognized for the role that they play, and one was groups that represent particular constituencies, whether it was disability groups, whether it was the Cancer Society, whether it was groups of retired Americans who made sure that the issue resonated for their particular constituencies. But even more important than that, I would argue, were the state and local groups on the ground who did the mobilizations targeting particular candidates. I can just remember weeks where we were like, oh my God, we've got to get activity in Lisa Murkowski's district, and frankly, our union doesn't represent a single worker in Alaska, and learning that there was the Juneau Health Advocacy Group and the Anchorage People for Universal Health Care. I'm making those up, but you understand the point, that the local groups who were willing to create activities and pressure, drive earned media, contact voters were incredibly important, and I think that's the strategy that we have to use here. Our union supports universal health care. We also support all of the changes that can be made to improve the Affordable Care Act, whether it is prescription price, negotiations over prescription drug prices, lifting the income level at which people can get subsidies under the exchange. There's myriad policy issues. The policy is actually not the hard part here. And so we are taking the position that we support all of those things because we don't think this is a moment where it's helpful to get into the debate of in the weeds, is this policy better than that policy? We understand there's a moment that you have to do that, but right now we want to keep focused on the frame, on the vision, on who the opposition is, and how we're going to get better health care for working people, for all people in this country, and address the kind of issues that we've been talking about, and I know you've been talking about for the last 3 days. So let me just close by thanking all of you for your advocacy, the work that you have done in the past, and the work that I know we're all going to do together to have a very different election day on 2020 than we experienced in 2016.
Anything else you two want to add, Matt or Geoff?
No, I've learned a lot from both.
Yeah, I like to say what the smart lady said. But actually, really, what the smart lady said, there's a dimension of this, whether it's the earned media, the direct contact, what have you, that this room in particular is well suited to take on. We have a deep cynicism in this country. They're all bought and paid for. We asked people about how they feel about impeachment. And 1 out of 10 folks who told us they're voting for Donald Trump thinks he committed impeachable conduct that merit him being removed from office. So the cynicism is deep because it's like, well, they all do it. Having the type of direct relationship, having the brand and trust, where the Juneau Health Workers Alliance, for example, if that doesn't exist, it should, where it is that voice that is saying, you are going to be considered. You're not going to be deprived of your well-being as we move forward, but we are going to move forward together. That's where you have confidence. So I say, let's take that action.
Okay, well, I think that's all we have time for today. So please join me in thanking our panel. Thank you all for being here.
It's always a pleasure.